This is Dr. Saguil with a tutorial on knee pain. Knee pain usually is found in the front of the knee. The knee is complex because not only does it have to take the strength of the quads. This is a knee model. This is actually a right knee. So you're looking at my right knee. The outside fibular bone, the strong tibia bone, and then the femur up top. With this thing, the kneecap, that essentially essentially a pulley. It takes the quads or the four muscles of the thigh. The thigh comes over and inserts into the knee here. So the quad or the thigh takes the muscles, big muscles, puts them all into one tendon and inserts them right here. Now, in growing up, some kids who have excessively tight quads will have something called Osgood-Schlatter disease. That's when these little prominences, these bumps are huge and painful. It usually stops by the time a young person stops the growing phase. Males, it's about 15 to 17. Young women, it can be a little less than that, so 13 to 16. But regardless, there's a lot of force that the quads put on this to go. And why is that? It's because you have to be able to translate force into movement. So this kneecap has to take that force and translate it over the edge of this bone, the femur, for 80 years. It has to be something that's very lubricated. So if you look at this model in a real knee, you'll see that the bony surface of this kneecap, the patella, has a coating of white. That's all cartilage. And this opposite part of the femur also has a coating that's cartilage. A drop of fluid, when you have cartilage on cartilage, will make it smooth as two pieces of glass sliding over with enough oil between them. So they'll go for 80 years. When you start to wear this down the wrong way, and you can see that there's a groove right in the middle of that femur head, or the end of the femur. The groove is where the kneecap, or the apex of the kneecap, fits right into the groove, so it sits there. Sometimes you'll have kneecaps that are excessively loose, and they'll ride to one side. Let me just turn this over. So if the kneecap is too loose, it'll ride from one side, and it'll slap one on the other. It'll hit here, it'll hit here. And that's going to wear down. If you have people that are knock-kneed or bow-legged, where the leg is bowing out, then you'll also have malalignment. If you have people that have flat feet, the foot, if it's flat, will actually turn the leg in a little bit, and it'll also cause a malalignment. This kneecap is supposed to go straight up and down in the ideal situation. If it doesn't, it rubs on one side, it's going to rub and wear. So there's a whole bunch of important things that happen from the ankle to the knee to the hip, and that's why it's very important to get a screening before school. And Illinois has a Illinois High School Association physical screen, and not only do we watch out for musculoskeletal problems, we watch out for Marfan's disease, we watch out for heart disease. So it's important to get a full screening. But again, back to the knees. This is also why the knee, of the problems that occur in the knee, the anterior knee is always one of the biggest problems. It's called patellofemoral syndrome. Some people will say it's right in the kneecap. Some people will say, like jumpers for basketball, it's in the knee, in the patellar tendon. That's where you put a Chopat strap on. Sometimes if you do have to wear any kind of neoprene brace, the ones with the hole cut out in the center are actually safer because they don't put as much pressure on the kneecap. Remember, if we want to keep this stable and in line, that's fine, but if you're putting pressure with an all-around ACE wrap, it's going to cause excessive friction, so you're defeating the purpose. So getting a neoprene sleeve gently keeps it in line, and it doesn't apply too much pressure, so that's the importance of an open neoprene sleeve. The other problems that occur, and again, if you have to fix your arches with orthotics, or if you have to change around the mechanics or change around the looseness of certain muscles, that's important to also do with your physical therapist or your exercise physiologist. But the other big problems are these things. Meniscus. A meniscus is a round piece of cartilage on both sides of the tibia. The reason it's round is because it has to have a little bit of a cup to fit the two heads of the femur into. So because it's round, these two heads, the medial and the lateral head, will fit right into there, and it'll stay like that no matter what position the knee is bent, whether it's bent fully or straight. It'll have a seat to put into. So that's the reason for the meniscus, but unfortunately a meniscus can tear, especially if you hyperflex like in yoga. Yoga is a hyperflex sport, but the yoga practitioners aren't in fast action. Soccer, where you're going down for a tackle and the back leg is hyperflex, is dangerous. Any sport where you're in contact sports also can be dangerous. Sometimes just getting up from a kneeling position is dangerous, but bottom line is that you have to be careful about meniscus tears. Once they're torn, you either have to fix it or take it out. The common problem you always see in football, RG3 is suffering from an ACL tear. That's the tendon right here called the ACL. It's also right here in this illustration. The anterior cruciate ligament is important. It's the most important stabilizer of the knee. It goes right in the middle of the knee, right in the middle of the femur, right in the middle of the tibia, and it's the basic stabilizer of the knee. So it sits there like this, and as long as it's intact, nothing moves, and it's nice and strong. You still have muscles on top and ligaments on the side. As long as it's intact, nothing moves. When it's gone, you have a lot of instability. So although you'll have muscles around and ligaments around, if it's gone, guys will have what they call a trick knee. I have a coach in a high school team that I used to take care of, and he never had his ACL fixed. I would always see him every game on the ground trying to readjust his leg to get it back in. And you know, that's a trick. It sure is a trick, but the thing that his doctor didn't tell him is every time it comes out, and when you put it back in, you have about a 70% chance of tearing a meniscus, and that's irreplaceable. ACLs you can replace. Menisci are a problem. So those are three things: patellofemoral syndrome, patellar issues, meniscus or cartilage issues, ACL tears, which are usually surgical. I do have a prolotherapy doctor in Oak Park, Illinois, who does prolotherapy to help the body fix small ACL tears that surgeons don't touch. I think he does a pretty decent job. The last thing, though, is a true fracture of the bone. If you have a fracture, and that's only found by x-ray, that's dangerous. You have bacteria that can sneak in. You have bone that's unstable. If you have a crack in the bone and you keep on walking on it, the crack can become greater. So those are the four things that cause chronic knee pain in patients that I see in my sports medicine clinic. The number one always being the kneecap. And it can be easily fixed. As I mentioned, you don't have to have surgery for that. It can easily be fixed by changing around the mechanics of the four muscles, sometimes getting an exercise physiologist or physical therapist to help look at how your dynamics are on a treadmill, changing around the physiology and the strength, working on fixing alignment by usually putting an insert into the foot, or actually working on flexibility of the hamstring, the other side of the muscle. If it's excessively tight on this side, it's going to make the quads work double hard to try to flex. Working on hamstring flexibility, working on symmetric muscles of the quads, working on insteps or correcting orthotics with correcting instep problems like flat feet with orthotics. Always important, always conservative, and usually all you need instead of just going straight to a specialist. So give it a try, see a good sports medicine doctor, and try to go conservative if you can. Listen to your body and take care of the problems before they become big issues.